Hi YouTube, welcome back to my channel. Thank you for joining me. This is Jenny, and I thought this time I would make a special video on just my rants and some of my events and different things that I've been thinking about, and I wrote down. And then I'll do another video for like a wrap up or whatever. But this video is specifically on just some of my rants and my vents. Did I say rats? My vents, some of advice and just different things I was thinking about. So the first thing that I wanted to say was be an STNA, be a CNA, be a nursing assistant. If you've not worked in the healthcare field, this is good advice because you will see what we do. You may not be passing meds, but you will be taking care of patients. And the best nurses are nurses who can wipe butts with the best of them. Give bed baths. You get used to ambulating patients, feeding patients, and dealing with patients in general. So be an STNA. No one's ever too good to be an STNA. Just because you're a nurse doesn't mean that you don't need to do CNA stuff like bed baths, feeding patients, changing patients. We all do it. You got to get used to it. Okay, the next thing is when you are in a program or about to be in a program, make sure you ask the people that are in the program about it, about teachers, classes, and advice, with a grain of salt, of course. I mean, that can't be the only thing that you do, but you got to make sure that that you're not going in blind. People that are in the program and have had the teachers have experiences that you may not have and have advice. Now, of course, you don't want to believe everything they say without using your brain, but it doesn't hurt to ask, right? So before you forget to get your STNA class or take a class online like pharmacology that I think you should never do. Pharmacology is hard enough, but taking it online, super hard. So do not forget to ask teachers and students and such about classes and different things about your nursing school. Okay, number 3. Everyone does not walk the same path. Some people go to nursing school at 18. Some people go to nursing school at 40. Some people go to nursing school at 60. It's different for everyone. Please don't feel like you can't walk your own path. So, don't just do your own thing, and all in God's time. If it's meant to be, it will be. So walk your own path. Don't shut doors of possible career options. How much can you know when you first start out if you've never been a nurse? How do you know you want to work with children? How do you know you want to work with older people? How do you not know you want to work in med-surg or vice versa? Just because other people have complaints about something, don't cut that out completely. Don't assume that starting out that you're going to work in a certain area. You want to stay open to all areas. Trust me, your opinion will change from the first day of nursing school till the end. Your opinion will change from the first day of nursing school through 5 years, 10 years of working. That will change. Don't think that you know when you walk in. And one of my biggest pet peeves are people that assume that they know what they want to do from the very beginning. Keep your mind open. Try lots of different things. Don't section yourself off to one area. Give all areas a chance. So don't shut the door on career options right away. You need to keep organized. From the minute you start thinking about nursing school, so the minute you walk in the door and the minute you graduate, keep a notebook of all your vaccinations, notebook folder, whatever, vaccinations, CPR cards, make copies. When you meet with a nurse, stay organized because you will need those things. In nursing school, you will need them when you get a job. You will need them for different classes that you take. So do not lose those things. Stay organized. Don't find things to complain about. One thing that really frustrates me are people that complain about everything. Not everything is going to be the way you want it to be. Not everything is going to be positive. But, just do it. Just do it. So please don't complain. Trust me, there'll be enough things that that are worth complaining about, you don't need to find them. Okay, so your job as a student, I'm sorry to tell you, is to give the teacher what they want to pass the class. You are not the only student in the class. There has to take care of all the students, and some teachers are nicer than others. Some teachers care, some teachers don't. Find out from the syllabus, from other students, from the teacher themselves, what they want to pass the class. Give them what they want and move on. Please don't focus on trying to change the teacher. If you disagree with the teacher, that's fabulous, but that's not going to help you pass the class. So get over it. Move on. Give the teacher what she wants and pass the class. All the teachers are different. So don't stay focused on that. You'll waste time. Valuable time. Nursing school is hard. Don't get caught up on something about a teacher you don't like or a class you don't like. Boo-hoo. Move on. Let's see. Okay. So don't section yourself off. Don't get cliquey in nursing school. We're in college. Don't, stay open to other people in your class because they may need you and you may need them. So if you're sectioned off and you don't talk to somebody or you aren't available for someone, then later on you may need their help and then they're not going to be available for you. So we all have strengths and differences. Start now. Start making friends now. Start building connections now. That doesn't mean you have to be best friends with everyone, but just stay open to other people. And yeah. So, but a really important thing is not to count so much on other people that you're not doing what you need to do. It still all has to come from inside you. So you can't rely on others to pass, but they can be helpful. And having friends in nursing school is definitely helpful. So just stay open to other people. School can be extremely different from real life. School is awesome, but you won't know until, and this is just what I'm hearing from other people. You don't, especially when I work in it too, but not as a nurse, but the abilities of a nurse on paper and abilities of a nurse in real life are completely different. Nursing is a very underpaid, understaffed, anything in the healthcare field really. Medical assistants, nurses' aides, nurses, very underpaid, understaffed, underappreciated bunch. So, don't expect at clinical that it's going to be exactly like you're taught. But you need to work, doing what your clinical instructor says to do. But just remember that on the outside of school, it's very, very different than what you read in the book. NCLEX questions are your friend. Learn to love them. And if not love them, learn to do them. You've got to practice your NCLEX questions. You have to learn how to critically think. That's what your NCLEX is going to be, critical thinking. It's not like the same go in, remember a word, put the definition on a page. You have to know how to take all the different scenarios, all the different situations, all your book knowledge, put them all together and using your nursing process into choosing the answer that makes sense, or that is not even makes sense, the answer that is the most important, that is priority. You have to know what they're asking you. So practice NCLEX questions. When you're doing, right now we're studying the heart. So I'm going to go into my NCLEX book and look up as many questions as I can on the heart, the areas that we're learning about the heart. So you need to start that now. Start that. Get an NCLEX book. I say Saunders for me is the best, but get an NCLEX book from the very beginning and use it. Learn to love your NCLEX questions. Almost done. Okay, so you can't expect everyone to bend over backwards for your dreams. It would be wonderful to say that, everybody's going to understand and your family's going to be able to, do whatever you need to help you. But you know what? If your husband works, like my husband, he works. And so if one of the kids is sick, he can't stay home all the time. He does a lot for me, but he may not be able to. You may not have a spouse. You may be a single parent, but there are times when you may have to stay home from class. But you let them know what your dreams are. They do what they can, but it's not going to be perfect. You're not always going to make it there. Just do the best that you can. But don't expect everyone to bend over backwards for your dreams. Just appreciate what they can do the best you can do, and plug forward. And you'll have to make sacrifices too. Don't think that it's just everybody else's job to make sacrifices for you. Trust me, in nursing school, you'll have to sacrifice a lot, but it's definitely worth it. So just keep going. There is not an age limit on education. I'm 36. I have friends. Most of my friends in school are 18, 21 years old. There are people that are going to nursing school when they're 50, 60 years old. It really, it's so variant. And it doesn't matter, but it's not always going to be, the same path for me isn't the same path for you. So it may not be it wouldn't have been the right time for me when I was 18, 21 years old. It wouldn't mean so much to me. I wouldn't have had the life experience to make it work. So, do not limit your education on age. Don't put a limit on what you can do at whatever age, because it's definitely possible. There will be setbacks. I had to withdraw last year because I just didn't feel like it was right for my family. I had to take some time. I had to think about it. I had to continue to build my confidence, which is always an issue for me. You have to be confident. You have to pull out that inner crazy person, and you just have to work. But sometimes you're just not ready. Sometimes you don't pass the test that you need to pass. You have a certain amount of dosage tests that you need to pass. If you don't pass them, you don't move on. But that doesn't mean you should give up, but there will be setbacks. So don't let setbacks make you think that you can't do it. Just because there's a setback doesn't mean that you can't. You just have to take a deep breath and move forward. But there are setbacks. It's nice to walk in and go, everything will be perfect, I'll pass and move on first time, I'm not going to have any setbacks, but that's a bunch of crap, because there definitely will be setbacks. But don't let that stop you. Don't let that stop you. Not everyone is going to get an A on everything. It would be wonderful if we could, but to be very honest, I don't think it's that important. Yes, A's are great. But a big vent of mine, and I'm not pointing fingers at anybody, but I don't want to hear about your grades. I don't want to hear about your percentages. I don't want to hear that you, I got a 98. No, I so badly wanted 100 and I got 100%. I really don't want to hear that. Great for you, fabulous, but that just because you get 100% doesn't mean you're going to be a good nurse, and vice versa. It's about taking the skills that you learn and the bookwork critical thinking that you learn, putting those together and making a good nurse. It's about experience. We're going to graduate and not know really what we're doing. It's going to take years and years of actually being a nurse on the floor, plugging away. So, keep going. Don't think that just because so-and-so gets an A and you don't, I personally don't think it's that important. It's important to know your stuff, but sometimes the best way to learn is to make mistakes. So not everyone is going to get an A. Let's see. Yeah, so like I said, you have to piece it all together. It's a big pie. Skills, bookwork, confidence, it all goes together. Please don't compare yourself to others. That's taken me 36 years to do. Don't compare yourself to somebody else. Just because you get a B and they get an A doesn't mean you're not going to be a good nurse. Please don't think that just because you may not have as much confidence right now, or that because you don't do perfect on giving your injection, or because you're nervous about giving a bed bath or whatever, that you're not going to be a good nurse. Please don't compare yourself. That's the worst thing that we can do. We're all in it together. Fake it till you make it. Do the best job that you can, and you'll get there. You'll get there. We'll all get there. There's nothing going to stop me now. I said that inner crazy person who doesn't give up is here, and she is not backing down. Make your own goals. Be proud of those goals. Don't expect other people to understand, or don't worry if they do understand. You're going to have support, but in the end, it's about you, and it's about how you feel about yourself, and it's about God, and it's about just being blessed, and it's about that we've been given this chance to go to school, to help others, to love others, and I'm definitely blessed to be here with you. And that's it. That's my list. I hope that you enjoyed it. I'm sure that there'll be comments. I hope that you have a wonderful day, And if you have any comments or questions, please let me know. If you have any video requests, and I'll throw a video up about how my week's been, different things that are coming up for me. But if you have anything to add, or you have anything, let me know. Thanks for joining me on my road through nursing school. I love you, and I will talk to you all later. Mwah. Bye.